Hi, I'm Dr. Divyashree, Consultant-Urologist at SPARSH Hospital, Infantry Road. Today I would like to speak regarding incontinence. Incontinence of urine can be seen both in males and females, but females are more commonly affected, with 30% of females being affected more than 50 years of age, and postmenopausal females above age of 60-65 years, at least 1 in 2 of them will have incontinence. So let us understand what are the different types of incontinence. One is stress urinary incontinence, second is urge incontinence, third is overflow incontinence, and fourth is mixed incontinence. Most important among all of these are stress incontinence and urge incontinence. Stress incontinence is something where patient passes urine or there is leakage of urine when the patient coughs, sneezes, or lifts heavy weight, or sometimes as severe as when standing up. So why does this happen? This is usually because of the weakness in the pelvic floor muscles or in the disangulation of urethra connecting to the bladder. So the pressure of the abdomen is directly transmitted to the bladder and there is leakage of urine. So how do we treat this? Patient needs adequate evaluation in the form of pelvic floor muscle functions. We need to rule out any active urinary infections, and we need to assess any other associated conditions such as prolapse of the uterus. And initial treatment for stress incontinence is in the form of Kegels exercises, and usually a pelvic floor physiotherapist or a urologist can guide you with adequate pelvic floor contractions. And with the adequate exercises, most of the mild stress urinary incontinence can be treated. Whereas in severe incontinences, there are further treatment in the form of tape surgeries, sling surgeries, be it autologous slings or synthetic slings, and even further, patient can be treated with these sling surgeries to have a better management of the stress incontinence. Coming to urge incontinence, it is usually caused by an overactive bladder. It can be because of a simple reason such as urinary tract infection, or it can be something as complex as some neurological disorders, or it can be an overactive bladder because of secondary to an obstruction. So these again needs to be evaluated using uroflowmetries, urine routine, and ultrasound abdomen with a post-void residue. A further evaluation, if we do not understand the exact form of incontinence, we may need to do additional tests such as urodynamic studies. So please do not suffer with the leakage of urine. Please do not settle with the decreased quality of life. Present to your doctor, meet your urologist, and get adequate treatment and be leak-free.